Breast cancer treatment can have a huge impact, not only physically, but also emotionally. People can feel anxious, depressed, fearful, and stressed. In this video, I'm going to share 3 things you can do to help with the emotional lows and challenging times following breast cancer treatment. Hello, my name is Dr Tasha and I'm a breast cancer surgeon. Number 3 is mindfulness. For those not familiar with mindfulness, this is a practice that helps you ground yourself in the present moment. It trains your mind not to wonder and to be aware of what you are sensing and feeling in the moment without interpretation or judgment. Focusing on the present means that you are with your thoughts and your feelings right here, right now. Professor Mark Williams is a former director of the Oxford Mindfulness Centre. He says that mindfulness allows us to become more aware of the stream of thoughts and feelings that we experience, and to see how we can become entangled in that stream in ways that are not helpful. So when we think about something, we start to worry, and before you know it, we are in a terrible place of doom and worst case scenario moments. And mindfulness can really help break this cycle of autopilot thinking. It isn't actually about not allowing you from thinking about these thoughts. What it does do is it allows us to acknowledge these thoughts exist and then enables us to let them go without allowing them to take over our mind and control it. Most of us have issues that we find hard to let go, Professor Williams says. Mindfulness can help us deal with it more productively. We can ask, is trying to solve this by brooding about it helpful, or am I just getting caught up in my thoughts? Sarah Lianage from Ticking Off Breast Cancer was diagnosed with breast cancer in her 40s, and mindfulness has helped her tremendously. She says, mindfulness has been the biggest help. Staying in the present, training myself not to rush ahead in time, and control the what-ifs has been really helpful. Mindfulness can involve methods such as concentrating on breathing, guided imagery, and getting familiar with the sounds and the senses in the present moment. And if you have never tried mindfulness, there are quite a few apps out there you can use to help with your practice. But the truth is, you can be mindful anytime throughout the day. You can be aware of the sensations on the ground, for example, whilst you walk, the sounds of nature around you, or even the hum of your car whilst you drive. This breaks the autopilot of the things we do every day and pulls us back to the present moment. It has proven so beneficial that mindfulness is recommended by NICE, which is National Institute for Health and Care Excellence, as a way to prevent depression in people who have had 3 or more bouts of depression in the past. Number 2 is yoga. The word yoga is derived from the Sanskrit root yuj, meaning to yoke or to unite, and is a 5,000-year-old system or principles and practices that originated in India. The practice aims to unite the mind and body through incorporating meditation, movement, and ethics. There are more than 100 types of yoga practiced, and there are the types that are less physical, concentrating on slow, deliberate movements and concentrating on breathing techniques, such as pranayama. Most modern yoga practices, though, are based on the asana practice, which is aimed to improve strength, flexibility, and stamina. And this is done by doing a variety of poses, such as those practiced in Ashtanga or Vinyasa flow, for example. The practice of yoga has been found to be extremely beneficial in helping those who are either in the midst of treatment or have finished breast cancer treatment. The benefits are not only for the physical side effects, but also for the emotional side effects of breast cancer treatment. Many research studies have found that yoga has beneficial effects to those who have had breast cancer treatment. And they include reduction in fatigue, reduction in stress, improvement in well-being, improvement in quality of life, as well as improvement in physical functioning. A Cochrane review found that yoga was more effective than no therapy in improving quality of life and reducing fatigue and sleep disturbances. It was also found that yoga was better for reducing depression, anxiety, and fatigue in women when compared with psychosocial or educational interventions such as counseling. This means that women with a diagnosis of breast cancer can use yoga as supportive therapy for improving their quality of life and mental health, in addition to standard cancer treatments. So if you haven't tried yoga, there are so many classes out there that you can join. You can even attend yoga classes now remotely through Zoom. Who knew? It is important, though, to make sure that you choose a yoga class whose instructor is familiar with breast cancer patients. You must tell them what surgery you have had and treatments you have received so that the instructor can make sure that the class is suitably tailored for your needs and ability. And number 1 is exercise, and to be honest, this doesn't come as much of a surprise. There's so much evidence to support the benefit of exercise both in physical health as well as mental health. This is also true for those who have been affected by breast cancer. And you can just ask anybody who exercises regularly. They do that because they feel so much better afterwards. Exercise is also a powerful tool in combating anxiety as well as depression. It can lift your mood and it can also help you sleep better. So how does exercise do this? Well, exercise promotes different changes in the brain, including neural growth as well as new patterns in the brain. And both of these bring about a sense of calm as well as well-being. Exercise also causes the promotion and the release of chemicals called endorphins, and these are powerful chemicals that can heighten the sense of well-being. So much so that the runner's high, which is the elated feeling that runners experience after a run, that is attributed to these powerful chemicals called endorphins. Studies have also shown that exercise and physical activity can be so beneficial to depressive symptoms, comparable to antidepressive medication. Exercise can also be a distraction and allows you some me time. It gives you a break from the potential worrying and negative thoughts that, if continued, can lead to further anxiety and depression. You can also use exercise as a mindfulness activity. If you are walking, for example, you can concentrate on each step you are taking, the sounds surrounding you, or even the sensation of the wind on your face. The NHS has recommended about 150 minutes of moderate exercise per week, or 75 minutes of vigorous exercise per week, and to spread this exercise evenly through 4 to 5 days. So that's not that much really, about 30 minutes a day, which if you can break down to 2 times 15-minute sessions a day, that doesn't sound very much. You can take a walk around lunchtime or walk around the block, for example. Now, don't worry if you can't commit to doing this. The most important thing is to move and to do something, however small it is. That is better than doing nothing at all. So, just start small. I hope this has been helpful, and if you would like to make sure you don't miss the next video, do hit the subscribe button, and I will see you in the next one. Take care.